because I use lifetimes, because I hope there is multi-universe, and in another universe there will be different version of you, would be with another judges as well. Sorry. So I am Suman Jha, founder of Jilo Health. This problem is important from multiple point of view, especially all of you are still young, super young. I mean, I'm also young, but you're younger. Just to give me sense, which year of engineering you all are? I mean, first year, second year, third year, fourth year? First year? Second year? All the years, right? Third year, fourth year, right? So, I mean, everything that you see today is work of many decades. And as India is progressing in terms of economic as well as other aspect as well, one of the biggest problem that we are facing in terms of aging population. So not long ago, couple of 5-6 years back, everyone used to call ki India is young nation, you know, we are like 25-26 years average old. But as you will speak to the industry folks, they will tell you that India is an aging population, and that is the biggest problem, because before even becoming developed, we as a nation, we're already getting into this aging problem aspects. And therefore, we need to think of that solution from right now, keeping multiple factors in mind, so we are not again getting trapped into the epidemic of the problem that is coming to us. Giving you brief that we are AI first continuous care. It's a new vertical or new category we are trying to create inside healthcare, which is being very affordably delivered to Bharat's 15 crore elderly population. So I am not from Patna. I mean, I am from Bihar, but not from Patna. I am born, brought up in a village called the South, which is in Samastipur. From here, it's around 85 kilometers. So after engineering, tried multiple startups, came back to Patna. Last year, my mom called me in sharp morning and told me that got unconscious. So I took a bus from Patna, reached to my village, then again arranged a cab something, and drove around 35 kilometers from my village to Samastipur, which is nearest local town, and then did everything for the whole day, from testing to doctor consultation, etc., etc. Spent around 15K. And of course, as you are into your professional life, you don't have that much time. So I came back from my village to Patna, and dad is relatively doing better. But if you really ask me, I don't have any understanding of how my dad is doing, because unlike most of the visual things, healthcare is very invisible in nature, except if it is acute care. I will explain what that is. And when I got the sense that, okay, the need of healthcare for elderly, especially 50 plus, is not at all what look like healthcare, what we see in general. It's different. And to solve that, it has to be think from the first principles, as we will see in a couple of slides. So I have used a couple of slides and to give you a sense that this is how India will probably look like in next 10 years. So if you see the graph, the young population, which is above 29, and elderly population, which is, below 29, elderly population, which is above 60, is sort of rapidly converging to each other. So not just 10 years back, our young population were around 26%, and elderly population were around 7.4%. In next 10 years, by 2036, the elderly population will be around 15%, which would be around 23 crores of the entire population. And to give you better sense, we as a nation have also increased our lifespan in the past 30 years. So earlier our lifespan, which means the human aging from birth to death, were around 65. Now it is around 70. But the bigger problem comes out is that it's not lifespan, it's health span. So on average, the health span, which is like the well-being of individual, is only 60 in India. And to make sure that the next of their 10 years is also very well behaved the way they did for the earlier, we have to start thinking 10 years ahead, and hence everything has to be modeled in terms of for next, starting from 50 to next 20 years. It's like, if that is, then the question is, so what? I mean, what if India's population is aging? The real sense I can give you is that it's similar to what epidemic we have experienced a couple of years back, which we don't want to remember at all. Because India is already sort of every parameter that you generally see. We are sort of 3 million hospital beds according to WHO requirement. We are sort of 1 million doctors. We are sort of couple of millions of paramedics and nursing staffs. And just to give you a sense in business term, to set up 3 million hospital beds, you multiply 30 lakh multiplied by 2 crore of capex. That many like number of crores we need in capex to set up these hospitals, which is impossible to do that in next 10 years. This means this has to think from what we have available now, and if you're not thinking about this problem from now on, it will be very difficult for us to be this developed nation that we have by 2047. If you have not watched, please go and watch it. I mean, not now, for sure, after this. It's one of the best inspiring movie which tells you about solving a problem. So, those who have already watched it, great. You will sort of echo what I'm going to tell you. Those who have not, here's the story. So, Apollo 13 is the 13th mission after this US said that they will send human on Mars, because this USSR sent the first human on Mars, and it was like space race. So this Apollo 13 program, which 3 astronauts from Earth went to Moon. So in general, I'm not sure like how. So so rocket take off, then it goes to the zero gravity, that is like low orbit. Then it again goes to the higher orbit, and from there it again fuel to the Moon's orbit. So the actual rocket does not land on the Moon. So the rocket is still orbiting the Moon, and this smaller version get down to the Moon. So everything went well. The astronauts landed on Moon, came back to the rocket again in Moon orbit. And then from there, due to an unexpected oxygen fire cylinder, they lost most of their fuels. Now since there's no fuel or very less fuel left, so they have 2 options. Either they can use those oxygen as their breathing one, or they can use it as fuel. So of course the command center on Earth contacted them, and so the team on the command center did something amazing. What they did essentially is that they gave them the stuff that were available at that specific point in time in that particular rocket. And in the couple of hours, they build a device with available stuff that can give them enough thrust so that the rocket could leave the Earth orbit and come to the atmosphere, and from there its gravity will do all the work. And they did that. The reason I told you this, because when you don't have many of things, like you cannot build hospitals beds, you cannot produce millions of doctors, you have to think what you have available in front of you. And what we have available is 3 things: technology, frontier health workers like paramedics and nursing staff, and this ecosystem that you have. Now parallel that with doctors. So how does doctors take the specific decisions about any kind of diagnosis? So they use symptoms as first, because the patient tells the symptoms. Today we already have technology which can give us the symptoms of patient to doctor remotely. There is enough telemedicine company doing that one. Second comes vitals. Today doctors don't do vital measuring to BH. I mean, either it's compounder or frontline workers who essentially go and collect data and then do the lab one. So that is also a solvable problem. However, the third component that comes out is called science. So when doctors go through this 10 years of their journey, they get this intuition of understanding the science of patient, and from that one they come up with the provisional diagnosis. But we don't have the technology of those science identification remotely through sensors or any system as well. Which means we have to build something on that one So the need of healthcare, or need of hospitals or doctors could be reduced as much as we can. And this is the problem statement. I'm assuming all of you have already gone through the document that we have shared. These are a couple of images. So you are going to take input as eyes, palm, mouth, or any other body part, and gonna use some sort of AI models. Of course, I will tell you what you need to do, what you need to do, and what you don't, and come up with this provisional diagnosis as output. Just to clarify this, you have to build a functioning MVP. Functioning MVP essentially means that there has to be a connected system, either cloud or local. The input has to be taken with the image, whatever the problem you are going to select it, and the output has to be clinically provisional diagnosis that you are going to work on. And the final documentation in terms of proper, how did you come up with, what was the methodology, and etc. etc. These are the evaluation criteria that we have. This simple 5-part, starting with how are you capturing the inputs, how accurately you are capturing it. Then the AI part comes out. Then technical aspect comes out, the application aspect, how are you sort of connecting every front end, back end, and the AI part. Then what is the accuracy of these provisional diagnoses as output you are seeing it. And the final is essentially novelty part, which is up to you. Just to give you sense, like what you shouldn't be doing is that using any of the APIs such as GPT or Gemini. That is not, because to give you context why, healthcare is different. Like if you are building a tool, you can build a tool, but that is not enough. You have to go through clinical studies and then CDO certification. And if you are building your own, it's different certification apply, which is easier to get the certification. If you are using some other, it's a different case. So what you should not be doing is to using any APIs. Rest is up to you. You can do fine tuning, you can do image processing, you can use whatever the available weights of different models that I have listed out, etc. etc. that you can do. By the way, you can even use the vibe coding, that is fine for building application. But the core of the problem that we are talking about, you should not be using the APIs. There is submission format that I am assuming a team will share with you. And this is what our team today here. We will be here today, tomorrow as well. The process is very simple. You all are going to work today till 5:30. Then you are all going to submit. And from that one, we will be selecting 5 who will be enhancing the solution tomorrow. And then from there, we will be evaluating the winners. So these were things from our side. And just to make it clear, I come from tech side, so I will be sort of handling tech question, and I don't know everything for sure. That's very clear, because if I knew everything, I would not have been here. And Dr. Kamlesh ji, who will be looking at the clinical side of the evaluation part, and even answering your questions as well. Okay, these were from my side. I would happy to answer your questions if you have any. Nice. Yes, yeah.
And one more thing I asked on the Discord also. The main problem statement doc only mentions about pallor, that is face, eye, these two things only. While the other docs, the GPT detection doc that we got, mentioned about tongue, teeth and gum also.
Yeah.
So we are supposed to include that or not?
So it's okay. So we kept the problem broad. We do not wanted you to constrain your creativity into this one, and therefore we have made it broader. So all of you can choose in a specific, even someone can choose this oral cancer and then you can try that out, that's fine. Someone can choose diabetic retinopathy, that is also fine. Someone can choose palm as well. So that is totally up to you. Take whatever the input you want. There has to be a specific provisional diagnosis as output, or if you would like to work on multi-models, that is also up to you. Yeah.
But like, can we use open source medically trained models?
Absolutely. In fact, I have mentioned this. that you can use any of the open sourced LLM models or any models, which is weight is there, and you can use it. That is not a problem. What you should not be doing, there is only one constraint, that you should not be using the APIs to do this specific part of things.
So we have to also take the Hugging Face APIs or something like that. Can we?
That you can do, yes. Yeah. Hugging Face API works, yes, because it's hosted there, so you can use that, and later on we'll sort of do that. The one thing that I did not added is, and we have discussed this, that our expectation from this is that we will be getting at least 2 of the solution from all of you, that we will be further sort of getting into the clinical trials or CDSO certification or even patent filing, and if we are doing as a company, we will be crediting your name, even like looking at how can we compensate you in that way as well. So with that one, I wish you all the best to all of you, and you all can start working.
Is there any expected set of diseases that we are supposed to tackle, or we can do whatever?
You can do, so we do not want you to constrain that part. Like you can even focus on one disease, that is fine, one specific one. Or if you think you have the capability to do multiple model, that is also fine. That is totally up to you. If you think you can do that in time constraint, which satisfy the need of the solution, you can do that. Okay. Awesome. All the best to you, all of you, and then we are here. If you need any help, we will be here itself. Thank you so much, everyone, and all the best.